everyone, welcome to another episode of KSSK CMD Chats. Today we're going to be discussing airway clearance.
So airway clearance is like clearing out our airways, obviously.
Yeah.
But what do you do specifically? Like, what did your pulmonologist tell you to do?
I have a cough assist, a trilogy, whatever. It has two settings that I use for cough augmentation. One is just stretching my lungs, expanding my lungs, so I can take deeper breaths. And the other one is, it like pushes air into my lungs like the other one, and then it sucks it out, which is like...
That must feel funny.
It does feel funny. I've gotten used to it though. When I first did it, it felt really weird because, like, not bad, it was just weird because, you know, never had something suck air out of you. Yeah, it's kind of just really abrupt.
Do you also use anything else, like a nebulizer or something?
No, I don't use any of those. You do though, right?
Yeah, I have a nebulizer. I've thankfully only needed to use it like twice. That did help me a lot, even though I didn't really notice the difference at first. This episode is all about this stuff, right?
Yeah, we'll be learning not just about the machines, but just in general about coughing.
How to clear those airways.
We're gonna go into the interviews now.
Hello everyone, I would like to welcome Dr. Kupfer and Dr. Meyer. Could you introduce yourselves for us, please?
I'm Oren Kupfer. I'm a pediatric pulmonologist at Children's Hospital, Colorado, and I help take care of kids and young adults with neuromuscular problems.
I'm Hank Meyer. I'm also a pediatric pulmonologist from the Children's Hospital of Philadelphia, and I am the medical director of our pulmonary function lab and have been taking care of patients with neuromuscular disease, and in particular congenital muscular dystrophy, for a number of years, and had the privilege of getting involved in Cure CMD pretty soon after it was formed, and have really enjoyed being involved with the wonderful things that it does.
So this episode is all about airway clearance. What is the purpose of coughing? Why do we cough?
So we cough to get stuff out of our lungs. Easy as that, right? We cough because when we inhale, we don't just inhale oxygen and nitrogen, unfortunately. We inhale all the particles that might be in the air, and those particles are filtered a little bit by our nose and by our throat and then by our lungs. And in order to get those particles out so they don't stay in our lungs, and so the inhaled viruses or bacteria that are around us all the time don't stay in our lungs, we have to cough. Cough is one of the two ways that we get things out of our lungs. The other is mucociliary clearance, or kind of these microscopic hairs in our airway beat mucus up towards our mouth so we can spit it out. But coughing is really the major form of airway clearance.
Why do people with CMD have a weak cough and hence have difficulty with airway clearance?
If you think about what you do when you cough, there are three phases, two that are pretty obvious. The first is you take a big deep breath. So the main inspiratory muscle is your diaphragm. So the diaphragm contracts as much as it can to pull air in as deeply as possible. And then you immediately shift to breathing out, and you use your expiratory muscles like your abdominal muscles. And in between that, for a very brief period of time, your vocal cords close for about a quarter of a second. The pressure builds up in your lungs, and then your vocal cords open, and you have an explosive flow of air coming up and out your respiratory tract, similar to what would happen if you blew up a balloon and then let the air out of the balloon, it would come flying out. And so the reason patients with CMD have difficulty with coughing is that their inspiratory and expiratory muscles are weak, and the amount of weakness in each of those muscle groups kind of depends on the particular type of CMD that you have. And so to then treat that, we'll use devices to help you both breathe in deeply and then breathe out forcefully.
What is cough augmentation? Because I do believe it has something to do with helping us cough better.
That is exactly what it means. Augmentation means to improve or to make better. So we're trying to make a cough better or stronger. So there are a number of ways that you can do that. As Dr. Meyer just explained, there's 3 phases to a cough. deep inhalation, vocal cords closing to generate pressure in the lungs, and then that exhalation and release. So we can try to augment your cough or strengthen your cough by treating each one of those phases. We can try to give you a bigger breath. We can't actually really help you close your vocal cords. You either do or don't do that. But then we can also help you exhale harder. So, we can give you help inhaling and help exhaling. And the best cough augmentation techniques do both together. So in time with your normal breathing pattern or your normal coughing pattern. There are a number of tools that can do this. They start with relatively simple things like breath stacking, so taking your own breath. And so you take what breath you can, you don't exhale, then you take another breath on top of that, don't exhale, another breath on top of that, right? So that can build your inspiratory capacity. And then we can also use an ambu bag or pressure bag to help you inflate your chest with big breaths. And then we can also use a cough assist device just for that part, just for a deep inhalation. And then to help you exhale, we can squeeze the chest as you breathe out. We can push on your belly as you breathe out to push up to force air out. So we can not really increase the strength, but increase the flow of air as you exhale. And then we can do both with the device I mentioned before called Cough Assist, which really is a fancy vacuum cleaner.
What about the device called a percussive vest? I have no idea what that is actually.
I believe it might be a vest that vibrates to like loosen up everything in the lungs.
Oh my gosh. I feel like I've heard of that because people with cystic fibrosis use that, right? And I watched 5 Feet Apart because I'm basic. And she's like lying upside down with the thing on her chest.
So patients with cystic fibrosis have pneumonias or bronchitis all the time, and they need the vest to help move that mucus along and then allow them to cough it out. Having a cough is a critical part of being able to effectively clear airways with the vest, which is why on its own it's completely ineffective in patients with congenital muscular dystrophy. But it sometimes can be helpful when patients have a lot of mucus production, such as when they're sick with a pneumonia, bronchitis, or viral illness. And it can be used in addition to the cough assist, but it's only effective if you use it before the cough assist, because the cough assist will obviously help to get the mucus all the way out that may be freed up by using the vest.
Thank you for explaining that. We know what cough augmentation devices do. They help us cough, they help us clear our airway, but can it really help with anything else?
I think what we sometimes miss is that we don't breathe the same all the time. We don't just take the same size breath when we're talking and when we're resting and when we're sleeping, when we're shouting at our friends, when we're yelling at our parents, when we're yelling at the TV. We need to take different size breaths all the time. And that requires muscle strength, our inspiratory and expiratory muscles. And it requires flexibility in our chest wall. It requires the bones and connections between the bones and ligaments in our chest, between the ribs and the sternum and the ribs and the spine to be flexible. Now, most of us who can take a variety of different breaths, a variety of different size breaths, do this on our own. But if you can't do that because your chest is restricted by muscle weakness, then those joints can get tight, can get contracted, kind of like your ankles if you're not walking, your hands if you have hand weakness. And so using cough augmentation devices can actually stretch your chest out and help you maintain that compliance or flexibility. So that's another way that we can use our cough augmentation devices. I think of it as physical therapy for your chest.
Yeah.
Some of us wonder if that can also help with scoliosis. We don't know the answer to that. Where if we give you a big breath, can we help push back on a curving spine? We really don't know enough about that, but it's a nice idea.
Yeah.
Yeah, that's interesting.
Something to think about. We heard about devices that can help with airway clearance Are there any medications that can do that?
Similar to the vest, which is used in cystic fibrosis, there are a number of medicines that we can sometimes use to help make the mucus thinner and easier to clear. And just like with the vest, we only really use them routinely outside of the hospital in patients that have cystic fibrosis or have really thick mucus. There's a type of mucus medicine called hypertonic saline, which just means concentrated saline. And what that does is that will pull fluid into mucus to make it thinner and easier to clear. There's some potential use in neuromuscular disease when you're sick, but there's really no basis for using it on a regular basis outside of an illness. And one of the reasons why we need to be cautious, it hydrates or brings fluid into all types of mucus, whether it's thick mucus, normal mucus, or thin mucus. And so if you don't have thick mucus and you're using hypertonic saline, what you're doing is you're pulling more fluid into normal mucus or thin mucus, and that means that you're making more mucus or increasing the volume of mucus, which then means that you have to work harder to clear your airways. These medicines can be effective if used under the right circumstances, but should not be used on a regular basis if you have neuromuscular disease.
Why is the topic of airway clearance so important, so critical for someone who has CMD?
I think that's the kind of maybe the ultimate question, like, why are we talking about this? Why is this so darn important? And why do your pediatric pulmonologists always ask you these questions, right? Where's your cough assist? How do you use it? Or do you need a cough assist? And the reason is because for any children, the most common cause of hospitalizations and illness is respiratory infections. Kids get sick all the time with colds. If you add muscle weakness on top of that, if you add the inability to cough on top of that, you're much more at risk for getting a significant illness where you may end up in the hospital. You may end up even in the ICU and you may get pneumonia. And so in order to prevent those things from happening, we get pretty aggressive about doing maintenance, daily chest physiotherapy or daily cough assist to help clear any secretions that might be in there before they cause an infection.
When specifically might it be necessary to increase the use of these cough augmentation assists?
That's a spectacularly good question. And it gets to one of my teaching points that I always make with my patients and their parents. And that is one of the challenges that you have if you have a weak cough is that you can't do what all the rest of us who don't have a weak cough do right as we're beginning to get sick, and that's cough. And if you think about it, you worry about somebody being sick if they're nearby because you hear them coughing, okay? And they're coughing for very good reason. When you get an infection, you start to get mucus produced in your lungs because of the inflammation caused by either the virus or the bacteria. And so as that mucus starts to form, it's important to start clearing it. And so if you don't have an intact cough, then it's important to bring out your cough augmentation device, like the cough assist, and do it more frequently as soon as you feel any sign at all of beginning to get sick. And the issue is that if you don't do that, then what can often happen is that you really start to feel bad. Then you go to your doctor's office and your oxygen's low, and then guess what the doctor says? We need to admit you to the hospital. To try and prevent that, it's both important for you as the patient to recognize that I don't feel well. I need to do more coughing. I need to use my cough assist more. And then going to the step of actually doing the cough assist more.
So, in summary, everyone who has CMD, no matter who you are, needs to use a cough augmentation device and try to prioritize airway clearance, not only when you're sick, but kind of in everyday care. This has been awesome learning from you both. Thank you so much.
Yeah.
You're welcome.
Thank you guys for answering our call.
Mm-hmm.
Yeah.
Video visit.
Yeah.
Take care, guys. Have a great day. For more ways to stay connected, download the CMD mobile app and sign up for the newsletter. Here is a link to the CMD Pulmonary Guide, which is very interesting. And if you have questions, email us at breathe@curecmd.org. And wait, before you go, be sure to like and subscribe. Add your comments below to keep the conversation going. Thanks again for watching. Bye!